Yeah. So what's the history here?
I had my shoulder repaired.
Yeah.
And was rehabbing that for about 4 or 5 months, and then was back to try and get back to football, and overloaded the Achilles. And got tendonitis.
So you were probably deconditioned.
Deconditioned.
Yeah.
I have quite a few ligament sprains and damage on my left side as well because of my arches. I think my ankle is swollen, less range of movement, so I think it just keeps getting weak over time. So we rehab it, and then it comes back again after a year or two. And it's in a phase of feeling a bit poorly.
So the jointy physios would probably say that you got a subtle lack of either mortise plantar flexion dorsiflexion or subtalar joint inversion eversion. Maybe a lack of shock absorption going on in there. Who knows? I mean, those are just possibilities. Or it's just you were deconditioned and it just blew out here. Related maybe to your other chronic ankle issues. Who knows? Okay, so when was this?
It came on about 8-10 years ago.
Oh, and it's been swollen, chronically swollen like this ever since?
It's in a bad way at the moment.
Right. Are you able to run pain-free?
Not completely.
Do you go for jogs?
Yes.
How far do you run?
10K?
All right. Does it take time to warm up in the sense that it feels stiff and it feels discomfort?
Yeah.
Does it get pain-free?
Yeah.
Okay, fine. So you've got a grade 1 plus grade 2 chronic Achilles tendinopathy. When you get up in the morning, is it stiff when you take your first couple of steps, like a plantar fasciitis would be? Are you aware of it?
No.
Okay.
Well, I say yeah.
Did it stop you from exercising 8 to 10 years ago to the point where you could not run?
No. I was like rehabbing it whilst doing all my PT and stuff.
Okay. All right. Turn the lie flat. So
Stop my heel.
So what I'm going to do is I'm going to needle his right one non-invasively. I'm just going to bathe the Achilles tendon in superficial needling. All right. And then I'm going to needle this one first invasively into
his problem.
Yes. His scarring and his thickening. But he doesn't have, it's not symptomatic at the moment. So he's just got chronic.
If you pressed it and it hurt, then you'd bathe it?
No.
No. Only if it caused
if
acute
I pressed
symptoms.
it and it hurt and it's still chronic and painful like this, and now he has pain with running, I'd needle it. It's chronic. It's been around for a long time.
Okay.
It's got poor blood flow and it's got scar tissue and granulated tissue and it's and if he went for an ultrasound scan, there'd probably be a nice big blacky area there where the tissues died. Maybe.
Okay.
Yeah. Is this? Yes, it is.
Yep.
Thank you.
No worries. If you want more, I can give you more.
I think that is juicy, isn't
Yeah.
it? It's juicy.
Yeah. Yeah. So we can either needle straight down, but it feels like it's going to be better off needling him from medial to lateral. And I'm probably going to put in 2, maybe 3 needles.
Medial to lateral.
Yeah.
Can you do PA as well?
Yeah, I said I could needle PA straight down.
But
You
not
can.
lateral to medial?
How are we going in?
And you can go lateral to medial. I'm going medial to lateral
What
because
makes
it
you
looks
say
like there's more stuff going on the medial side.
Is that exquisite?
You're just staying
Right.
with
Have
the
you needled-
ball.
quite nice.
Have you needled this
Yeah.
yourself?
Yeah.
Have you needled this yourself?
Pain.
Oh, it's all the way in. In like
I compress it and squeeze it and run a golf ball over it. It feels nice but painful to do.
You haven't
It
needled it
feels
yourself,
similar.
though, Richard.
And it helps.
Sorry?
You haven't needled it yourself.
No.
That'd be quite a hard one to get the angle on.
No. Okay, Gus to do
Your son. You trust him more than your wife.
it.
Okay, I've put 3 in because it's got quite a big area. When I demonstrate, I only put 1 in.
Do you both sides in the same time?
No, I'm going to just do probably in the first session only from the right side
Okay.
and see how that goes. Yeah.
And how frequently would you do this?
Probably once a week.
Your other leg arm, yeah.
Once a week.
And I'd want him to exercise. But now he doesn't have severe pain, it's not debilitating.
What sort of exercise?
What he does,
Just
play football, run,
running. Yeah.
hike,
Yeah.
and to assess.
It helps build new tissue, the exercise, doesn't it, as well?
Eh?
It helps build new tissue. If you've got dead stuff and it's metabolized.
Yeah, I
Cells
don't-
Blood
wanna
flow's going
get
through,
these
right?
I don't think it's going to regenerate tissue, to tell you the truth. I just
No,
think what happens is that eventually over time, it becomes non-painful.
Mm.
And you just are left with degenerated, dead tendon tissue.
So it's not
So-
going to shrink that down.
No, that's going to stay exactly like it is. It might, a little bit over time, go down, but not significantly.
Go back to your foot normally.
Oh, you're still going all the way in?
Where?
So this is bathing.
This
now.
is bathing now.
Yeah.
So now I'm not needling into the tendon.
Oh, you're needing round it.
Now I am just going to needle around in the skin, around the tendon, and I would leave these needles in for 20 to 30 minutes and see if it creates a superficial blood flow in the area. And it's for a acute inflammatory tendinopathy.
So you wouldn't go medially because you've got your vascular bundle there?
No, I'm going to go immediately.
You are?
Yeah.
I'm
Just making sure it's like right,
right in it.
right in it. Yeah. Right.
Do you mind if I feel this side?
Sure.
And how does that feel for you?
There's quite a lot of sort of throbbing and soreness coming from the needles. So I can't really feel you, to be honest.
You can.
Georgie,
Feel you.
Oh.
Yes.
But I
can I have
feel
another
the-
15,
feel
strip
them
of
in
15s,
there.
please.
Does it feel different to muscle?
The pain.
Mm.
Yeah.
Your bathing is looking good.
So, you have
Yeah.
Tom, Dick, and Harry come down like this, here, in there.
Yeah.
So I'm going here.
Going just behind it.
Yeah, I'm going closer to the Achilles. That one
Tib,
could actually go
post.
maybe there.
Extent flexor digitorum, flexor hallucis,
Put one in
longus.
my heel.
Tom Dick.
In my
We
heel.
can do.
So
No, is there
tibialis,
No.
digitorum, hallucis.
You may have the
Thought you were
perception.
asking for
I
it.
had the perception of a
Yeah. You may have the perception of it's like a referral, but we do needle Sever's disease.
What's that?
Sever's disease is the inflammation, the pain from the Achilles insertion onto the calcaneum.
Oh.
So it's an enthesopathy. It's a tenoperiosteal
Is that
problem with
usual?
runners.
Oh, it's in runners.
Yeah, very common in runners. Very, very painful. Very difficult to treat. And it's right over there, right there.
Mhm.
And it's normally very chronic. And so you find the exact part of the pain. You stick the needle in. It goes in about 3 or 4 mils onto the bone, and you do periosteal picking. And you want to reproduce the pain. And your differential diagnosis that you must make sure is that the pain is there and not retrocalcaneal bursitis.
So you're aiming for the tendon attachment, not
Correct.
for the bone
No, the
itself.
tendon attachment onto the bone. That's the tendon attachment onto the bone. And so
Yeah.
you're needling. There's a tendon. This is the bone. You the bone. This is the tendon. You're needling
Onto it.
there at
yeah.
that junction.
If
Does-
you, sorry, you carry on.
I was going to say, does that increase the risk of an avulsion fracture? or
No.
something?
All you're doing is creating micro trauma to a junction that has poor blood supply. And you're trying to get that blood flow to heal that chronic injury.
Okay.
If you had someone who had ruptured Achilles,
Yeah.
gone through the period of
Conservative management.
yeah,